How's it going? How's it going, chat? How's it going? 1 second. It's gonna dox me. Oh. Oh, they don't even have tags yet. They don't even have tags on Kick. That's interesting. Anyways, guys, I can't revise, so that's why I am doing this. Very interesting. I've got this on. Hopefully that helps. What else? Oh yeah. Let me just check something. Ow, my eyes. Oh man. Yeah. Hashtag shorts. Anyways, how's it going, chat? How's it going? How is it going, chat? How is it going? How's it going? How's it going? How's it going? Even though I have no chat, I'm just gonna say how's it going, chat. 1 second. Gotta make sure not to mess anything up. Okay. That should be fine. If I now click this, everything should work. Cool. Hopefully that worked. Alright, nice, it worked. The ghost of chance fast has come to haunt you. Yes. I prefer it this way, I think, for revision anyway. Let's see. Ow, my eyes. Every time I refresh the page, the screen goes white, and that's perfect for my eyes, as you know. So, trying to go live shorts. Why is it what? It doesn't let me. Connecting stream software. Connect stream software to go live. Okay, finally. There we are. No wonder shorts was late last time. Let me see your thing. What's my thing? My wallpaper. You want to see my wallpaper? 1 sec. Why would man want my wallpaper? Huh? What my wallpaper ever done to you? Alright, anyways. Here's ChatGPT. Obviously the best thing to revise. I'll just disable this. I don't need it right now. It's my wallpaper. Nothing special. It says the time. It's pretty good at this. I don't know. Nice and simple and boring. But you know. I don't know why I've named this Sacco, but you know, I thought it'd be special. Anyways. I shouldn't really be we gotta get into this, bro. This is fun. Not. Alright, so let's see what I've written down. Actually, I need the light on, actually, I think. I need the light on. I want to show you mine. Oh gosh, I think it's something degenerate probably. Is it? So market, please surprise me by being normal for once. Very fun. Oh no. Oh no. Anyways, what I've written about vitamin K so far is, yep, the bleeding risk and nephropathy. I didn't know I had vascular complications as well. So warfarin, because vitamin K dependent proteins prevent calcification. Okay, so let me just write that down. Vitamin K dependent proteins. Vitamin K protein stops calcification. Stops hardening and thickening of vessels, I guess. So where have you sent it, by the way? I don't even know where you sent it. So may have increase in serum creatinine, so the muscle breaks down, and hematuria. Hematuria. Blood in the urine. Oh yeah, of course. Oh yeah. Hematuria. Hematuria was... I thought there's uriasis presence in blood. Interesting. Hematuria, blood in the urine. Hematuria. If they have calcification, which makes sense. Of course, there's gonna be blood in the urine if you have nephropathy. Haven't sent. It's just an anime wallpaper. Oh, do you have wallpaper engine? So high INR. So that's probably above 2 and 3. Was it internationalized? Is it internationalized or internalized? Internationalized, I think. Yeah, international normalized ratio, which is the level of anticoagulation in blood. So if it's a higher value, if there is a high value, they have a higher risk of nephropathy. Okay. So yeah, hematuria comes from nephropathy. Sent it. Oh gosh. Okay, I'll have a look in a second. This can lead to increased arterial stiffness. Yep. Arterial stiffness from calcification makes sense. Discord. Alright. Skin necrosis. Why would that happen? Oh, it's rare. I don't think I'll write about it. Maybe. Let me just see. Is it rare? Skin necrosis? Oh, it says not rare on the other thing. Okay, interesting. Lesions. Why would that happen though? Oh, protein C gets decreased. So I think what warfarin does is inhibits coagulation factors. Was it 2, is it 2, 7, 9, 10? Was it 2, 5, 7, 9, 10? No, yeah, it's 2, 7, 9, 10. And what was it? Protein SC or CS? Protein C and protein S, I think. Yeah, oh yeah, protein C is the one that stops skin necrosis. Interesting. Immediate cessation of warfarin and administration of vitamin K, which will help that would help bring back, what was it again? Yeah. Bring back down the international normalized ratio, basically. So yeah, give them vitamin K, the internationalized normalized ratio will come down. Heparins. Why would a heparin help? Because I'm guessing the thing would already be high, anticoagulation level. Initiation of warfarin with heparin bridging in high-risk patients can reduce risk. What? But if you have a skin lesion, why would you want to anticoagulate it even further? That is very interesting. Alright, well, I'll just write that down anyway. Skin necrosis. Skin necrosis. use vitamin K plus heparin. Then you also have purple toe syndrome. Purple toe sounds like something Soul Market has. I'm joking. I'm joking. Before you kill me. This rare condition is atherosclerotic plaques. How do you get atherosclerosis from this? Trying to look. So it's mostly for. Just try and look back at my notes because I can't see why this would cause atherosclerosis. Speak like a normal person. I am speaking like a normal person. Atherosclerosis is how would this happen? It didn't really say. Interesting. Okay, whatever. So atherosclerotic plaques due to the warfarin therapy. Sudden onset of, oh wow. Discontinuation is normally required. Okay, I won't even talk about that, to be honest. How about the abdominal plane? That makes sense. Abdominal plane. Let me just write that down. Basically, I'm pretty sure it'll basically cause abdominal bleeding, right? So let me see what it says. Abdominal plane, yeah, from gastrointestinal bleeding. So of course, it's going to cause pains. Adjusting the dose. Oh, underlying cause of the pain. Oh, the warfarin, isn't it? I got 4 mil bounty today. Hey, nice, man. It sounds like you said you got 4 mil bounty in one day, but I'm guessing you got 2 4 mil bounty. Yeah, Cake is an interesting place. Though. It doesn't even say anything. Look, it says no, nothing. It doesn't say anything. Like it doesn't say 0. It doesn't say 1. What is going on? Do I even have any follows on Kick? I don't even know. Kick follows. Oh well. I'm on my computer now, so I can help you better with my info. What info? Oh yeah, wait, let me have a look at your wallpaper. What is your wallpaper, bro? Oh my goodness. Let's go in here. Oh no. What the heck is this? Oh, okay, nice. What is this, bro? Is that Tokyo Ghoul? It's it doesn't work as a wallpaper, bro, because you just got like a really low resolution image, so of course it's not gonna work as a wallpaper. Got my singing monsters there as well. That's funny. Anticoagulant, yeah, whatever. Yeah, it's of course anticoagulant, but yeah, inhibits coagulation by inhibiting factors 2, 7, 9, 10 and protein CNS, and then when that happens, basically like stops coagulation. Pretty good. What does it mean? Not reduce viscosity. Viscosity is from lack of fluid in the blood, would it not be? To protect against stroke. Yep. Atrial fibrillation. Why in atrial fibrillation would it help? I wonder. That's interesting. Or artificial heart, that makes sense. My grandpa is on it. Oh, wow. Yeah, so if your grandpa is sitting in place a lot, unless he's hopefully not, he hasn't had stroke already. Because they also use it for like secondary prevention as well, or first prevention, or maybe the doctor thinks maybe he should be put on it for first prevention. But yeah, normally elderly sit around a lot. Their blood doesn't. Is stasis the correct word? Stasis. Let me just search stasis. Yeah, long period state of inactivity. Yeah, inactivity basically. Yeah. So the blood is in a state of inactivity in the legs, and it causes clots in the legs normally. So that's thrombosis, VTE thrombosis. Not good. Let's actually have a look. Actually, what does NICE say? This is the British version of like guidelines that you should follow. in the UK. So if I search up VTE, okay, venous thromboembolism. He has 5 strokes. Oh gosh. Yeah, he would definitely be on warfarin. They would have to do a lot of tests on him, right, to keep him within the target INR ratio. To check the level of like anticoagulation he has. So if he I'm not sure. Yeah, he probably doesn't have that, but yeah, they normally try and keep it in between 2 and 3. And what else is there? Let me try and think of what else you need to do anyway. Venous thromboembolism. British. Yeah, where is... So this is just where's the management of guidelines? Management. So this is... Wait, this should show the management. Yeah, management. Quality statements. Oh my goodness. Oh. It's a lot of rubbish. A lot of rubbish. Statement 1. Yeah, I don't care about the quality statements. Alright, carry on, carry on. Okay, wait, what? Ah, there we are. Quality statements. Quality measures. No. Oh, there it is. Why didn't that come up first? Okay, cool. Diagnosing and managing. Oh, there's a lot of point system as well. The DVT well score. Let me actually remember that. Actually, I need to remember that. DVT well score. DVT Wells score. That's what it's called too. And then what is it? DVT likely is only if you get 2 or more points. So yeah. Alright, let me just see management or low suspected or confirmed, yeah. So yeah, interim therapeutic anticoagulation. In the section of initial and diagnosis. Come on, man. Where is it? Why is it not showing me? Okay, finally. Yeah. Oh yeah, D-dimer tests. I forgot about those. Oh gosh. I'm so behind on remembering all this stuff, bro. Oh my gosh. I need to remember this stuff. D-dimer tests. I can't remember what D-dimer was. D-dimer test. Need to remember the normal range as well. So yeah, the D-dimer is a piece of protein that's made when a blood clot dissolves. So D-dimer test. D-dimer test. Protein. Yep. Checks for blood clot. So basically, some people, they have lack of that protein that will stop. You're just struggling, right? Yeah. So yeah, they have a lack of that protein that will get rid of clots, basically. So you need to check the D-dimer is normal first. Then you got to put them on interim therapeutic anticoagulation recommendations. Where the recommendations? Just consider anticoagulation treatment. Come on, man. Give me the anticoagulation treatment. Where is it? I feel like normally, I think it's just because I know it's normally like either warfarin, but the what's it called? XA inhibitors, thrombin inhibitors, heparins. Although they said heparin was more for I thought heparin was for I guess that's more for VTE instead of stroke. It's like you're teaching me. I got to be able to teach it to other people for me to be able to remember it myself. So I'm just talking to myself, really. But also, I guess you're there as well, so it sounds like that as well. But yeah, if you ever got to learn something, make sure you can teach it to someone else. Search anticoagulation. Yeah, bro, it always just comes up with this, bro. No. Long-term anticoagulation. Let's at least have a look at that then. Yeah, they don't actually give the drug, which is very strange. I don't know why. Normally they'll just tell you the drugs that they normally give. I guess people have, each doctor has their own sort of thing they do for this one. That's very strange though. For every other thing, they tell you exactly what drug is first line. So if I go to hypertension or something, they'll tell me exactly what to do. But okay, let me just check. Actually, they do tell me on hypertension, right? Hypertension in adults. Starting antihypertensive drug treatment. Discuss. Oh yeah, you gotta do the QT test. Oh gosh, not good, not good. Technically you're talking to yourself because I'm just strange on the internet talking to you. Yeah, basically. Virtually, yeah. I was like, what? Virtually. Yeah, virtually. Oh yeah, clinical. I need to remember these, bro. I don't know why these never stick in my head. 150 by 90. These are so simple stuff to remember, but just 150 by 90. Is their clinic blood pressure? Because normally when people go into clinic, basically, their blood pressure naturally goes higher because they kind of get nervous. So, yeah. That's a bit strange, actually. Why is none of the guidelines? Am I just dumb enough, forgotten way to actually look in the guidelines anymore? Treatment. Ah, here we are. Note that. Okay, yeah, cool. ACE inhibitors. Maybe your grandfather's on an ACE inhibitor. Wait, what else would he be on? If he's had stroke before, he'd be on some anticoagulants. Maybe his blood pressure is high. First line for that is an ACE inhibitor. So that would be April. So Lisinopril. What else is there? Why am I forgetting everything? Crap. This is bad. This is very bad. I don't have much time left. Need to revise this quick. An ARB. Okay, so there we are. Tell you to do an ACE. Often, okay, step 1 treatment. Often ACE inhibitor, 1 ARB, starting 1. Have type 2 diabetes and are of any age or family origin. Aged under 55, but not. What's this mean? Recommendation 1.43. Oh. So yeah, black people basically have you should have a preference with an ARB instead of an angiotensin converting enzyme inhibitor. Okay. And do not combine them either because of hyperkalemia, I believe. Offer a calcium channel blocker, but then normally they get edema. Yeah, they normally get edema with CCBs. So then you offer a thiazide-like diuretic. Oh yeah, that's for hypertension, isn't it? So what would that be? Hydrochlorothiazide, I think. Cool. Then if there's evidence of heart failure as well, thiazide-like diuretic. Oh, bendraflumetazide is also one. Oh yeah, this one's the one I was saying, hydrochlorothiazide. Oh, bendraflumetazide. Oh yeah, sure. We just remember that one actually. That one's a good one. Everyone uses that one nowadays. Bendraflumetazide. Where did I write about thiazides? Where do they affect again? I think they affect the early distal tubes, I think. Tubules, sorry, not tubes. Which do sodium and chlorine exchange, I think. I'm not sure. Co-transporters are there, I think. I can't remember. But that is bendraflumetazide. Thiazide, sorry. Continue with the treatment. Considering what the hell is this, man? Where the hell is this, man? Alright, anyways. So. Offer CCB or this. Hit or this. Review. Okay, so step 3. So yeah, there's no other thing they do. I mean, I know there's nitrates, but I don't know if I think they're more for angina. Angina. Not good. Not good. And then severe. This is just gonna say some random crap. Ah yeah, the white coat effect of 20/10. So yeah, 20 what's it millimeter of mercury higher. That's what postural hypertension is characterized by, I'm pretty sure. So if you have postural hypertension, then I think it's 20 millimeter of mercury higher in systolic and 10 higher in diastolic. So that's interesting. Very interesting. Very interesting. Alright, anyways, that's enough of that one. What the hell? Why you guys in the middle? 5 stroke. 12 years, 5 strokes. I don't know how many strokes normal people have, but yeah, 5 does not sound good. I don't. Hopefully he's doing well now though. But yeah. Ooh, there's an alcoholism interaction with warfarin. CYP2C9 inhibitor. So increased bleeding risk of vitamin K in the food. Increase the clotting risk. Interesting. Right about that, so there is. It's contraindicated. Protein that. Wait, let me just write about the D-dimer. D-dimer protein is that breaks down. Wait, is D-dimer itself the protein that breaks down, or is it the protein that gets produced? Oh yeah, it breaks down itself. Okay. That breaks down clots in blood. Alright. Contraindicated in pregnancy. CYP2C9 inhibitor. I don't know, been streaming anyway. 25 minutes. Okay, that's not too long. CYP2C9 inhibits. And there's, oh yeah, you need to watch out for vitamin K in the food. I didn't know it, so vitamin K is like quite important for clotting. Well, I did know, but I've forgotten everything to be honest, so not good. Advise on signs of bleeding, so that'd be like bruising, wouldn't it? Bruising, other silly stuff like that. Onset is usually around 2 to 3 days. That takes a while. 2 to 3 days. Onset. Is there a specific time people take it out? There's a narrow therapeutic index. Yeah. Yeah. All right. On to DOX. I'm already tired. This is what happens when I'm revising. Oh man. I get tired so easily. Alright, next one. I need to finish all the... Bro, I'm not even past all the bleeding. I mean, like, heart, blood sort of stuff. So, this stuff is the stuff that takes ages as well. Oh, man. I get tired so easily, man. When I'm revising. Normally I never feel like sleeping at this time. Really want to give up. Alright, well, whatever. Whatever, man. Whatever, man. Alright, let's see. Also, wait a second. Yeah, Kick does not tell me. Oh wait, I got 2 views on Kick. What the heck? Oh, hello guys. It's so weird though. Why isn't my thing showing I have any views on Kick? I have to check Kick manually. Alright, let me pop out the chat so I can read in case anyone ever says anything. I doubt it, but you know. Let's pull that out there. I'll put that there. Cool. Alright, anyways, let's go back. What's that doing? Oh yeah, this. Alright, we've looked at... Sorry, I'm giving everyone a flashbang right now, but... I wonder if there's actually a way to turn the... I doubt it. Sorry. Sorry, flashbang peeps. Alright, anyways. So... what was it gonna do? Wait, what the hell? You can send... voice messages on Twitch. I mean, Kick. Identity badges. Oh, never mind. It looks like a voice message. Wow, interesting. Bing. I'm just gonna write Bing in chat. There we are. Oh, that's cool. Yo. Anyways. I don't know why I wrote Bing. Okay, anyways, so. What was I talking about? Doax. Warfarin. Now I'll write about Doax. Doax. Dabigatran. Let's write about that. Let's see what it says. This is only for secondary prevention of stroke. Wait, so I wonder... Solmarket's grandfather should be on this, I think. Because he's had it more than once. I'm just gonna use this to keep myself awake. Oh man. This is... Why does this always happen? I get so tired so quick when revising. Alright, anyway, so Dabigatran. Dabigatran. So it's a direct oral anticoagulant. So what does that mean? So it directly inhibits thrombo. Oh yeah, I remember everything now. Without the need for routine monitoring. Yeah. Makes sense. And reversibly inhibits it as well. Alright. Factor 2A. So factor 2A. Factor 2A thrombin. So warfarin also does that though. Warfarin does 2. Factor 2. So that's interesting. Providing a predictable anticoagulant effect without the need for routine monitoring. Essential for conversion of... Oh yeah. Yep. So thrombin, fibrinogen to fibrin. To fibrin. Enzyme. Key step. Yep. So inhibits both free and fibrin bound thrombin, I'm pretty sure, if I remember correctly. So free and fibrin bound thrombin. So yeah, that would stop it in its tracks, basically. Main stuff. Stop basically like platelets forming together, I think. Used in DVT as well. On my side, does it say that? Oh yeah, it does actually. VT prevention. Interesting. Harder to form blood clots as well. or systemic embolism in AF. Ooh, systemic sounds. That does not sound good at all. Systemic embolism. Okay, so is that a thing in thingy as well? Yeah, it is. Systemic embolism. So yeah, this is like the second line. First line is warfarin. Second line seems like not first line, but I'd say like first prevention that you can do. So secondary prevention, right? We wrote that down. Secondary prevention. All right. Patients undergoing hip or knee replacement. Oh, for DVT. Okay, interesting. Okay. But I think isn't like enoxaparin or something better, I guess. But okay. Predictable, pretty good. Rapid onset as well. Rapid onset. It relatively short half-life as well. Quick reversal effects. Wow. But it doesn't even get affected by vitamin K, so why is it not first line? Everything so far sounds good. Oh, bleeding. But I mean, that's also for warfarin as well. Oh, monoclonal antibody. Interesting. Gastrointestinal symptoms such as dyspepsia, indigestion, and abdominal pain. So dyspepsia is kind of like for a lot of drugs, though. But okay, dyspepsia, indigestion. I keep on forgetting dyspepsia means that. I keep on getting mixed up with a different word. Maybe I'm dyslexic as well at this point. Taking with food or switching to a different DOAC may help alleviate. Okay, direct anticoagulant. Okay, so what's the C stand for again? Direct oral anticoagulant. Or C stands for coagulant. Okay. Primarily excreted by the kidneys. How do I have 2 views? I need to like what's going on with Kick right now. Very interesting. I don't know if this is just bots or not, but thank you whoever was watching. I don't know. Probably myself. I guess this maybe counts as one. And what else will count as one? I don't have it on my phone, so someone's just it's probably a bot. Anyways, so uses excreted by kidneys. Excreted by kidneys. Renal impairment. Oh yeah, that would be a big issue as well. Wait a second. I was gonna say if this is if warfarin is the same as well. Isn't everything renally excreted though? Most of things anyway. Dose adjustment may be necessary. Yep. Creatinine clearance is less than 10. Yeah, that makes sense. So INR is generally not required. Very cool. Renal function is recommended. Yeah, that's true. How it carries the risk of bleeding and particularly gastrointestinal bleeding and requires careful consideration with renal impairment. Yeah, I don't really see any downsides to this drug. I don't know why it's not used more. Interesting though, interesting. So yeah, let me just write about, so fibrinogen to fibrin thrombin is inhibited, so fibrinogen cannot turn into fibrin, which in turn prevents platelet what's the word? Platelet coagulation itself is the thing. Aggregation, I guess. Prevents platelet congregation, platelet aggregation. An arrow to fibrin. So yeah, you get bleeding risk with this. So I mean, that's obvious though. Obvious. Compared to warfarin, there's no need to monitor the INR, no food interactions as well. Yeah, it's alcoholism as well with warfarin as well. Let me just write that. Yeah, I haven't wrote that. Okay, that's a big thing, alcohol. Alcohol with warfarin is a big no-no. Anyways. Lower bleeding risk. Oh, there's a lower bleeding risk? Lower than warfarin. And this fixed dose as well. Yeah, that makes sense because no fluctuating levels or anything. The capsule and take with the meal as well. You could just take it with a meal to swap the dyspepsia. Or is it dyspepsia that you get from this? Yeah, indigestion, yeah. Sounds like a solid drug to me. Sounds like good. And then we also have a apixaban. Oh, I think what people, instead of dabigatran, they go to a direct ZA inhibitor. Was XA, sorry. I don't know why I said ZA. This is how you know it. It's just way too late right now. So apixaban, rivaroxaban, yeah. This is much better. So yeah, they block thrombin production instead of thrombin itself. Interesting. Harder to form blood clots. So XA, I think it's 10A, I'm pretty sure. I think that's what that means. X is 10, I'm pretty sure, so. Okay. What are these called? Yeah, so instead of direct thrombin, direct. Yeah, this is kind of easy to remember, I think. Direct. So yeah, warfarin, there's 2, 7, 9, 10 factors and protein CNS. Then dabigatran is directly thrombin itself, which is factor 2A. And this is 10A. Pretty easy to remember. Direct XA inhibitor. And I think it has the same like side effects as well. So XA is thrombin production. But this is secondary prevention, so just gotta remember that. VT prevention after hip or knee replacement as well, so to remember that. Apixaban and rivaroxaban. Rivaroxaban. So yeah. Primary prevention, warfarin. Secondary prevention, DOAC. Direct oral anticoagulation therapy compared to warfarin. Cool. I think I remember most of this. Oh yeah, systemic embolism as well. I need to remember just what. I think that just means. Yeah, okay, I know what that means. Systemic embolism. It's too late, that's the problem. Systemic embolism. Affect. That's right, affect or affect? Right, affect. Yeah, I'm just convinced this is just fake. What does this mean? There's 2 watching. Alright, anyways, next. Yeah, so just remember to take with a meal to stop. Let me just write that. Take with a meal. Cool. But I need to remember warfarin also inhibits something as well. CYP2C9. Warfarin's a big L of a drug, I think. It's just dirty. Dirty drug. Dirty boy. What am I even saying, bro? Anyways. Should I look into heparins now? I think heparin would be a good idea. UFH. What's UFH? Heparin. What? Oh, unfractioned. Oh yeah. Oh yeah, of course I remember that. Oh bro. Antithrombin. Key clotting factors. I can't remember any of the factors. Which one does? Right, okay. I think once I hit the 1 hour mark, I might just end it, chat. And then try again tomorrow in the morning. Be a good idea. I was supposed to get through all of these 5 days ago, really. Yeah, 4 days ago. It's now 4 days. I've only got 5 days left. And I'm still doing this. This is side quests. Oh man. Wait, this inhibits thrombin as well? Interesting. Thrombin seems like the main... Is there an enzyme? Because it catalyzes fibrinogen to fibrin. Yeah, it's an enzyme, I think. Bro, I'm so tired. I definitely gotta try this again tomorrow though. It's been helpful. Been able to actually do something for once. Let's see, wait, how many more have I got left? For oh my goodness, there's still quite a few for heart. I've got antiplatelets and antiarrhythmetics. Arrhythmetics are important. I keep on forgetting those. I think that's the only ones left though, antiplatelets. And heparins and low molecular weight heparins. Alright, let me just... Okay. Used for prevention of venous thrombosis. No, venous embolism? What is it? Venous thromboembolism, isn't it? Thromboembolism. Yeah, thromboembolism. Bro, that's how you know it's so late. That's supposed to be something I know. Used for the treatment and prevention of DVT and PE. Wait, warfarin is used for which type of... Oh, it's also used for VD, okay. I was gonna say. Prevention of... Oh, same stuff as well. Also used for bridging between warfarin. What does that mean? What does that mean? Used for bridging between warfarin. Yeah, these are very fast and short half-lives as well. Pretty good. I think dabigatran has got 12-hour half-life, and this is 1 and 2. Pretty good though. And they're reversible as well. Wow. I think dabigatran was also reversible though. I can't remember what. Oh yeah, it was like a monoclonal antibody. I can't remember which one. Started with I think. Okay. That's a bit long to remember, okay, but okay. Platelet counts. So yeah, this one also does thrombin though, so let me just have a look at mechanism of action. So binds to antithrombin. Inactivates those, stopping the production as well. Prevents conversion of fibrinogen to fibrin, reduce the formation of fibrin. Bind to antithrombin though. What does that mean? Binds to antithrombin. Ooh, osteoporosis, not good. Platelet counts is essential. Yep. Which one's the one that did calcification? I think that was warfarin, wasn't it? Was that warfarin? I think that might have been warfarin. Yeah, vascular calcification. Very strange how stuff works. Okay, interesting. Okay. So yeah, it binds to antithrombin, which is an anticoagulant in the blood. This binding significantly increases the activity, which then inhibits more. Okay, so what unfraction heparin. So UFH heparin does, it binds to antithrombin. Increases inhibits clotting factors. Stops thrombin from converting fibrinogen to fibrin. Yep. Yep. All right. I think that's. Let me just have a look. Ow. So yeah, just need to look out for, I think there's heparin-induced thrombocytopenia. Is that here? Cytopenia. Oh, here it is. So yeah, platelet counts need to be done to thrombosis. Immune-mediated adverse effect. How would thrombosis happen from platelet counts dropping? Wouldn't it be from platelet counts increasing? Thrombosis is thromboembolism, right? Yeah. When blood clots block your blood vessels. So let me just search this. Severe complication that can occur in a patient that may cause clots instead of preventing them. It means you have a low level of platelets which help your blood to clot. So if you have a low level, then why would it cause clotting? That does not make any sense. You know what? I'm just gonna remember it and I can't be bothered. So heparin-induced. Heparin-induced. Thrombopenia. Thrombocytopenia. Okay, that being increased, that means that platelets drop equals thrombosis. Cool. Well, not cool, but you know, I remember now. So yeah. So let me just remember. So we have DOACs. There's quite a few DOACs. There's a direct inhibition of thrombin from dabigatran. What does dabigatran do? Yeah, directly inhibits thrombin. Or blocks the action of it. I think it's a block the action of it or it inhibits. Yeah, it just inhibits the thrombin itself. Yeah, which makes sense because this ends. Yeah, inhibits thrombin. Cool. Stops fibrinogen turning to fibrin. Then there's factor XA inhibitor or 10A. These include rivaroxaban, apixaban, and I can't remember any other ban, but you know, these, that factor is the, how do I explain it? Production of thrombin? How would I say that? Yeah, it just blocks thrombin production. So by doing that, yeah, you again stop fibrinogen turning to fibrin. Thirdly, we have heparins. What's this one called? Unfractioned heparin, I think. Unfractioned heparin? I can't remember exactly. And this also, this one binds to antithrombin, which in turn inhibits several clotting factors, one of them also being factor 2A, thrombin itself. By blocking that factor, you again stop fibrinogen, turn into fibrin. Epic. Alright, now finally we have enoxaparin. I haven't learned about that one yet, but let's see. What does that do? Oh, it didn't even say. Alright, let's see. What did it say? I always see enoxaparin in hospitals, so I'm guessing they use it over. Yeah, they like using the low molecular weight one. Why would you want to use low molecular weight? I don't know. Monitor renal function. And APTT can be used for bridging warfarin gap in surgery in high-risk patients. Bridging between warfarin, what does that mean? But yeah, let me just read about this APTT thing. I think it's important. The anticoagulation effect is monitored using activated partial thromboplastin time, aiming for therapeutic range. So activated partial thromboplastin time, I'm not going to remember that, but it's normally 1.5 to 2.5 times. So activated partial. This is like trying to remember the other one as well. PPAR alpha reductase inhibitor. I've forgotten what that was for, but that's one of the drugs as well. Activated partial thromboplastin. Done quite a bit in this hour, I think. Well, have we? I don't know. Let's see what did we get from warfarin, DOAC, heparin, and low molecular weight. Not too much, to be fair. Not too much. I have wasted a lot of days. Anyways, activated partial thromboplastin time. APTT. APTT. 1.5 to 2.5 times normal. Interesting. Okay. Is that everything? Risk of bleeding makes sense. Osteoporosis. Oh yeah, someone said that. Reversible alopecia. Oh, that's kind of annoying for some people. Very sorry if that happens. What does this mean by bridging between warfarin? Alright, let me just see. So and low molecular weight heparin, high sweat difference. Let's search that. It involves using a short-acting anticoagulant, which is these, during the initiation or interruption of long-term anticoagulation therapy. So interruption. Ah. Well, why would you even want to interrupt it in the first place? For surgery? Okay. Yeah. Ooh. So yeah, when C and S get reduced, then that can actually cause a hypercoagulable state. So normally, when warfarin started, CNS reduced before clotting factors. This causes hypercoagulable state. Coagulable state. Okay. Ah. So yeah, the low molecular weight can bridge between it, but that doesn't. These low molecular weight they're not like dirty as warfarin, so they won't block all these other clotting factors. So won't that still take the same amount of time? I have no idea. And also, yeah, CNS is still a problem, isn't it? Is it not? Oh, I guess. Oh no, it's not a problem if you using them at the same time, I'm guessing. The initiation concurrently, yeah, that's what I was saying. Until INR reaches 2 to 3. Once stable, the discontinued and warfarin's used as sole anticoagulant. Okay. Okay. Yeah, vitamin K epoxide reductase leading to decrease in active vitamin K, and that stops these ones 2, 7, 9, 10. So yeah. Vitamin K epoxide reductase. Enhances the activity of antithrombin. Three to 5 days, whereas these are like a couple of hours. A common, why does it look like it says a common L? Does not require regular monitoring, but I think it's the ABTT that you needed to monitor. Was it? Let's see what it says. I didn't even say that. What? I just closed my eyes for no reason. Yeah, so you can just give them vitamin K from food, fresh frozen plasma or prothrombin. Would you want to do a low molecular weight heparin though, because it also says osteoporosis here, so I don't think having this long term is that great. I don't know. What was the side effects of warfarin again? Let me just try and remember. I can't remember. Then I'll scroll up. Warfarin side effects. Yeah, I think it's nephropathy, increased risk of bleeding. Let's see what it says. Yeah, same thing I said. Oh yeah, and the vascular calcification, that's bad. Or abdominal pain, all sorts of stuff with that. Yeah, makes sense. Just need to remember it just has a bleeding risk, big bleeding risk with warfarin. So you also get that. It doesn't say bruising, but you know, like that, those purple toe syndrome. And what else was there again? Let me see. Skin necrosis. Yeah, bad. Not good. So it didn't even tell me low molecular weight heparin versus UFH unfraction heparin. So the difference is it mostly inhibits 10A, which is the production of thrombin, whereas heparin binds to 2A and 10A. So yeah, there's more predictability. Interesting. Okay, so let me just write that. So low, oops, more predictable because more so affects only 10A. What's this called again? I can't remember what it's called, but yeah, 10A versus oh, this is too tiring. I'm gonna go to sleep in a second. 10A versus 2A. How to write 2 again? Oh yeah, IIA. Bruh, that's how you know. That's how you know. So yeah. But it says monitoring not really required, and then it also told me about APTT. What? I guess probably you need to use that if you're bridging for warfarin. I'm guessing. But yeah, that's tough. I've got a whole antiplatelets left, so that's aspirin, clopidogrel. Antiplatelets kind of sounds the same as anticoagulants. Because anticoagulants stop fibrinogen. It seems like that's all they do. Stop fibrinogen. Stop thrombin, which stops the conversion of fibrinogen. Whereas antiplatelets, what do they do? Oh yeah, COX-1 and 2. Yeah, I forgot about that. Oh yeah. Okay. Thrombocytopenia is interesting. Reduces platelets that much that you go to an extent of hypercoagulism. Body works in interesting ways. I don't know why I said hypercoagulism. I don't know. Hypercoagulating. I don't know. Alright, anyways. I think that might be it. Let's see. SC has kick increase. Yeah, we're still on 2 views somehow on kick. I don't know how, but hello, 2 views. Anyways. I think that's enough of that. So thanks for watching. I'm probably gonna do this again tomorrow. Try and actually get through a lot more drugs. Right now I've only got done most of the hard ones. We've got antiplatelets, antiarrhythmetics left for heart, well, for blood and heart. Then I've got quite a few. Antibiotics. I think I won't go in depth about antibiotics. I've got endocrine. I've got brain stuff. Oh gosh, that's gonna be annoying. I've got pain as well. So we've got, I've got pain in IRL as well, but I mean, analgesic stuff. I think that should be it though. Laxatives as well. Maybe I need to go into that. I've forgotten a lot about that. So yeah. America Vitamin, England Vitamin. What the hell? What the hell, soul market? Okay, so yeah, that's that chat. So bye bye. End stream. Wait, let's just check, guys. Let's see, what did our guys want to see? grand total amount of views. Dun Bruh, short streams, bruh. And they said short streams is gonna help me out. This is just such a sad moment. Laxatives make you take a dump. Exactly. I didn't remember the difference. I forgot to know everything about them. There's two different types. Well, two main different types. I think there's a few others, but yeah, two different types. Anyways, I'm gonna end this stream and then I'm gonna end the other one. Anyways, it's just me. Yeah. Bye bye short stream. And now bye bye this stream.